Hello, everybody, and welcome to another episode of Currently Speaking, the podcast of the Current Consulting Group. I'm Bill Current, president and founder of the Current Consulting Group. And today we have a very special guest for the first of four parts. We're going to be talking to Mike Jeffries from ClearStar. But before we do that, let me just remind you to like and subscribe and share with others our podcast. We want to grow our viewership, and you can help with that. If you're interested in viewing past episodes of Currently Speaking, you can go to our website at currentconsultinggroup.com, where you'll find an archive of past podcast episodes, some of the webinars we've done, some with ClearStar, of course, and blog posts that we put on there. So there's a whole extensive archive of past productions that we've done. Go to currentconsultinggroup.com. You'll find it all there. You're welcome to it. And then share it with others. So we can grow our viewership and get more people involved in the discussion. Also, if you have any ideas for future topics for webinars or podcasts, let us know that as well. Just go to info@currentconsultinggroup.com. We love your ideas. And if we use one of your ideas, we'll give you a shout out during the presentation. So help us out with topics and we'll give you a shout out for that. But let's get going with today's podcast episode. I'm going to be speaking with Mike Jeffries from ClearStar. And Mike, welcome to the show.
Thanks, Bill. Yep. Appreciate you having me, and look forward to sharing some information today.
Now, for those of you who may not be familiar, Mike has been in the industry quite a while. I'm gonna ask him to tell us about his history, his resume in the industry. But I will say this: Mike is one of the people that everybody in the industry loves. He's an expert on drug testing, employee screening. He's been in a number of ventures that have been very successful over the years, and somebody that everybody in the industry really loves and respects. And so, Mike, thank you for doing this. This is a real great opportunity for us to be talking with you.
Yeah, no, that's quite an introduction. I don't know what to say, but thanks a lot, Bill.
So how did you get your start in drug testing? I mean, where did it all begin?
Yeah, it was sort of a happy accident. So I graduated college in the late 80s, right about the time that of course, nobody really knew drug testing as an industry yet. It was really becoming more commercially viable as an industry at that time, sort of in the infancy stages to employers specifically. And as I got out of college and was looking for my first gig, the girl that I was dating, who's now my wife, had a friend who was working for a laboratory in the Research Triangle Park area here in Raleigh, North Carolina, called CompuChem Laboratories. Not a lot of people will know that name because 2 years after I joined CompuChem in 1990, they got acquired by Roche Biomedical, which eventually became LabCorp. So the first 6 years of my tenure, I went through a couple of different, mergers and acquisitions there into what is now Laboratory Corporation of America. So I was hired initially in the customer service department through a friend of hers, as I said, and at that point, it really just kind of took off. About a year after I got there is when the Omnibus Transportation Employee Testing Act was passed in 1991. Which basically was the start of, DOT testing, the mandate for DOT testing. So through what was then NIDA, the National Institute on Drug Abuse, CompuChem was at the forefront of that, and it enabled me to come in right at the right time as the industry was really starting to take off.
So, and I started in 1989 at the U.S. Chamber of Commerce with the Institute for a Drug-Free Workplace. We were all just sort of figuring it out, right? It was very new back then. What did you do to gather information and learn more about things?
Yeah, it was like drinking from the fire hose, as you say. I tell you, the one thing that stood out to me was we were in the news quite a bit right out of the gate when I joined there, and it was because our West Coast laboratory, Chem West, had just conducted the blood alcohol test for the Hazeldine, I believe his name was, the Exxon Valdez captain. And so as a result, there was a lot of, legal action taking place around that event. And, we were getting a lot of exposure because of that. So, at that time, I think starting in customer service was really the best thing that could have happened to me because I learned how drug testing works, the operation behind it. I was interacting with virtually every department within our organization, supporting sales, supporting, finance, even, you name it. And so it really was just sort of a flood of information that I just organically gathered through that position I started in back in the early 90s.
And I've heard you present before, Mike. You're an excellent presenter. You have a wealth of experience, but expertise as well. And you've gone through a lot of different iterations in the industry. And now you're with ClearStar, which is, one of the great brands in our industry. Tell us about ClearStar and what's kind of unique about ClearStar in terms of, the services you provide and how you do that.
What really, attracted me to ClearStar was the fact that, their ClearMD product, which is a wholesale solution specifically designed for CRAs to sell into other CRAs and support their drug testing efforts, so they can sort of, not have to worry about it. Is the fact that, with the drug testing, clinical, and occupational health services that we offer in sort of a white labeled solution that, really offers white glove service to our CRA partners. My perspective, I spent about 8 years working for CRAs as well through the course of my career. So I've gotten to see both sort of sides of the coin there, both from a provider standpoint and a sort of retail standpoint. We don't sell direct to employers. We only support our CRA partners, and really just building out a robust sort of operational and customer support model wrapped around really great technology. Leveraging a very large, expansive clinic network to support us in an electronic format. All of these things sort of came together, and for me personally, it felt like just the perfect fit from basically my experience.
And that also brings up an issue. I mean, you've seen a lot of changes in the industry over the years. I mean, you've been at it a long time. What are some of the major changes that we've gone through as an industry that lead us to where we are now? And then in particular, I'm thinking of CRAs. Back in the very earliest days when you and I were really new at this, it was really, we were trying to figure out what a TPA was and the role of MROs and stuff. But the background screening side of the industry of employee screening has really become a prominent part of the world of drug testing. But what are some of the biggest changes that you've seen over the years?
Yeah, I mean, where do I start, right? I mean, I think it starts with maybe the consolidation of the industry from the early days. I mean, when I first joined CompuChem in 1990, I think there were around 125, 130 laboratories that were certified or getting certified to do drug testing. And just through the mergers and acquisitions over the years, what was probably 40 or 50 national providers is now just a handful. That right there, probably the biggest change I've noticed. And the same is true with the TPA and CRA industry as well. So, I mean, to your point, I think that, the rise of CRAs and the importance they play in this industry really came about because, employers were looking for, it's all vetting a new candidate, right? It's all ensuring that, you're minimizing your risk and they want one provider where they can just, they can go to and rely upon to provide a good applicant experience, but also really to provide all the services under one roof, if you will. And so, I've seen a lot of the, again, the mergers and acquisitions in the TPA and the CRA industry evolve, I think, because of some of those needs that employers have.
And so at ClearStar, for example, you work with a lot of companies. I mean, like you said, you're not necessarily marketing directly to the end user. You're
Right.
working through a network of providers. How's that work? I mean, is that plan, that sort of business model, is it viable going forward, given some of the changes that are happening in the industry? Does it make you more attractive to providers?
I think so. I mean, from the standpoint of us being the subject matter experts, if you're a CRA, for example, drug testing is sort of and all the other things that go with it are sort of a means to an end because, really their core business is background screening. And, to build an infrastructure like we built to support all the things that go with the services we provide is a big undertaking. I mean, you got to hire a lot of people, you got to train them, they have to understand the industry. And in the MRO piece, as you mentioned before, we have our own MROs on staff, which is important because you have to have that piece of the puzzle built in. So to me, I think it's important that I think we're becoming more attractive for that reason to the CRA market, strictly because they don't want to necessarily go out and reinvent the wheel. They don't want to put the resources behind building the infrastructure and the network, automation, and all the technology that goes with it. We've done that. So for that reason, we're the perfect partner to come alongside and help them.
Now, you've mentioned MROs a few times, and ClearStar is obviously a big player in that. But you've been through so many, different companies that you've been with, and you've seen the rise in the early days of the prominence of the medical review officer part of the process. Talk a little bit about the importance of the MRO service.
Yeah, it's critical. At the end of the day, how do you protect yourself if there's litigation around a positive drug test? If you don't have that piece buttoned up in the process itself, you're really exposing yourself to risk. And at the end of the day, you also want to do right by the candidate or the employee, right? So I think that the key thing about the MRO piece to me is not only ensuring that you're protected, but also a lot of employees or employers now offer a second chance to employees who get tested positive through that process. And so to be able to sort of come alongside the employer and the service provider, and to work with organizations like the SAPs that are out there that can come along, come in after the fact and help with bringing those employees in a return of duty fashion back to their positions. I think that's a positive thing, and it's a necessary thing just to ensure everybody's protected, including the candidate and the employee.
Yeah, I've written a number of times over the years. People probably get tired of hearing me say this, but the drug test has to be perfect every time. If there's any flaw in the process from the collection to the result reporting, you have to throw that test out. And the MRO really is sort of the gatekeeper of that process. It comes to the MRO and they determine whether everything's okay and if this guy's got a valid excuse so that MRO role is, as you say, critical to what has to be a perfect test every time.
Yeah, and also I always try to counsel employers that I've talked to or partners that I've talked to that, hey, at the end of the day, if you're acting on a drug test that has not been MRO reviewed, you're doing a disservice both to yourselves and to the prospective employee or the employee themselves. At the end of the day, you got to have that check and balance in place to really ensure the integrity of the process being followed.
Now, there's a lot of stuff going on in our industry right now. The legalization of marijuana in so many states, possible rescheduling of marijuana, new technologies. I know you're a big proponent of oral fluid testing. We'll talk about that in another episode. But, where do you sort of see the future of drug testing given all that's going on right now?
Yeah, it's a great question. I think employers around marijuana specifically, with all this going on, both at the state level and at the federal level, I think employers are pretty confused in some cases about how do we go forward with marijuana specifically. Obviously, we're assuming that there will be a safety carve out with DOT, that they're going to continue to mandate it as they should. But at the end of the day, even your non-regulated testing programs really no different than alcohol from the standpoint that if an employee has been using, let's say, within the last 24 hours, especially if it's on the job, even in a non-safety sensitive position, they're going to be impacted from a performance standpoint. So you're going to be looking at underperformance or lack of performance or brain fog, whatever you want to call it, is going to impact how they make daily decisions around their job, right? So from that standpoint, I think as an employer and an HR person specifically, you have to consider how do we draft a policy that's going to be fair, but also that protects our business, right? Our business interests. And so that to me is the biggest challenge I think employers face with marijuana. And then beyond that, the one thing I've noticed, and I think this is where I think the industry has gone in a positive way to some extent, is from the standpoint of speeding up the hiring process, but ensuring that all the checks and balances are still in place. Point of care has come a long way. I mean, at the end of the day, you have a number of point of care tests out there, not just urine, but even oral fluid, where super highly accurate for the purpose of screening, the initial screen, instrumented so that they are able to process sort of a lab sort of a lab accurate test, but then also be able to transmit and take advantage of technology in terms of how they transmit results and send results to their respective end users. So to me, I think point of care is going to become more prevalent as we go forward, especially with the cost of laboratory logistics, getting specimens to the lab, the amount of time it takes, all those types of things. Be able to put the ability back into the hands of employers to actually help sort of manage and facilitate the process, right? And so, and to some extent, even proctored events, the ability to virtually manage the process outside of a clinic.
Yeah. So you see drug testing surviving, it sounds like.
Yeah, I do.
Yeah. Let's give the audience just a little teaser for our part 2 podcast episode on oral fluid testing. We're going to talk about it extensively in the next episode, but what is it about oral fluid testing that you like so much?
Well, I was part of the original laboratory that offered it commercially in the United States. And right out of the gate, one of my mentors was a gentleman by the name of Dr. Michael Pete. Mike really had, in my opinion, had a vision for oral fluid testing that others may not have had at the time in the late 90s, and understood that there was going to be a market for it. Not everybody was convinced there was going to be a market for it because there was a lot of preconceptions about oral fluid and the ability to detect and be accurate and provide a wide enough window to be meaningful. So as part of that initial commercial launch back in the 90s, really, I really grasped a hold of that concept and that vision myself, to the point where I'm a huge proponent of oral fluid testing, always have been. Love where it's going in the market. It's still evolving, but it's come a really long way. So I look forward to talking more about that.
Yeah, thank you, Mike. We're going to get into that in great detail in part 2 of our 4-part series with Mike Jeffries from ClearStar. Thank you for joining us for part 1 of this series. If you have any questions for Mike, let us know at info@currentconsultinggroup.com. We will pass them on to Mike, and Mike or somebody else from ClearStar will answer your questions. If you would like to see past episodes of Currently Speaking, they're at our website at currentconsultinggroup.com. You'll find past episodes of our podcast, as well as webinars and blog posts. They're all there at currentconsultinggroup.com. Mike, thanks again for joining us today for part 1 of this 4-part series.
Thank you, Bill. I enjoyed it. I appreciate it.
All right, everybody. Have a great day.